Thank you very much for that beautiful introduction. So let me take this opportunity to talk to you about equity and inclusion in research integrity. I am going to focus a lot of this presentation within the context of the conversations that happened during the the 7th World Conference on Research Integrity that happened in Cape Town, which the previous speakers, Professor Lex and Zoe, have referenced. So again, I also want to make it clear that my presentation will, even though I'm going to delve into equity and inclusivity, I'm going to focus a lot on these principles within the context of Africa. I'm going to do that because that is where I have most experience, but I want to believe that the discussion that I'm going to involve you will also cut across, especially trying to make a distinction between some of the tensions that are, arise where research happens, in collaboration between high-income countries and low-income countries. So perhaps my reference to the global South or Africa, context will, mostly, resonate with what happens in many of the instances in low and middle income countries vis-a-vis high income countries. All right, so I want to first put this into context that as already alluded in the introduction. I'm a co-founder of the African Research Integrity, and obviously because this is a network that is positioned within Africa, we have our key vision being promoting research integrity in Africa and for Africa. We have very specific values that are also very linked to the topic of this evening. It's evening here. It's about 8 p.m. So our core values include cultural cultural identity and sensitivity, which has its origin from the concept of Ubuntu. Those who have read about the history of Africa and more so South Africa will understand what this means. So Ubuntu and respect. Professionalism is another value that we hold very dear, which includes rigor and responsibility. But related to the topic of this evening, one of our core values is fairness, which includes fairness in partnership, collegiality, and collaboration. And then the other value relates to honesty and accountability. And of course, if you want to know more about ARIN, you can of course use that URL or that link to read more about ARIN. But also to put this conversation into context, it is important to understand that when I talk about Africa, I'm talking about a continent that is home to nearly 20% of the world population. And it is a continent that is endorsed with natural resources, cultural and religious diversity. But the flip side of the continent is that it is also the continent that has the highest burden of disease. So currently, it's still the continent that has the highest burden of disease. And of course, with that comes with the increased need to conduct research and innovation. I must say that over the last decade or so, there has been a tremendous increase in the clinical research, in terms of the number of clinical studies that are happening in Africa, but also the complexity of these studies, in terms of just the models and the methodologies that are being used to implement these studies. And if you look at this from both an ethical, ethics point of view, as well as research integrity point of view, you actually realize with the increase of research, clinical research, and the complexity that comes with this, it requires robust ethics review that are able to interrogate these methods and these approaches. but also it requires a system that can be able to reflect on what are the practices that are being implemented on the ground in terms of the research integrity, practices and principles. Now, when you look at it from the perspective of Africa, we have to say that in terms of research ethics, there has been quite a tremendous increase in terms of awareness, in terms of systems. So there are quite a number of, in fact, almost every country now has an ethics review committee that reviews research before research is implemented. But when you look at this from the perspective of research integrity, the picture is totally different. So there's very little awareness about what research integrity is, leave alone the fact that there are no systems and structures in place to support research integrity practices. Now, to even put that into a wider context, you obviously have heard about the World Conference on Research Integrity. And just to give you just a flavor of the history of the research integrity of the World Conference on Research Integrity, the first World Conference on Research Integrity started in, it was started around 2007. And there has been several world conferences in between, but it wasn't until this year in May, June, when during the 7th World Conference on Research Integrity, when that was actually, conducted on the soil of Africa. And that is not to, downplay the fact that research that happens within the region is consumed globally, and the fact that little is actually, known about the research integrity practices of researchers who are, conducting research in Africa, mainly because we don't even have systems in place to be able to really document or report on, all the other aspects that Professor Lex has talked about. What are the research integrity, practices? What are the kind of research misconduct, if any? What are the kind of questionable research practices that happen in Africa? Little is known about that. And based on this, it's really important and to underscore the fact that the happening of the World Conference on Research Integrity on the African soil was really, really, really important. And the fact that the output of this conference was the Cape Town statement, which was premised on, amongst other things, fairness, equitable partnerships as an essential basis for research. And when you look at this statement, which is currently a preprint version, it's publicly available, you will realize that we have put a lot of, the statement puts a lot of focus on fair practice, equity, diversity, and inclusivity, which are now going forward are going to be the focus of my presentation. So why is it important to think about fairness, equity, diversity, and inclusivity as critical values and critical components of research integrity? The discussion around fairness during the World Conference on Research Integrity was such that first, it is important to understand that fairness is basically the impartial and just treatment or behavior without favoritism or discrimination. And therefore, it means treating people according to their needs. This does not mean you treat everyone equally, but it means where there's there's need, then the support, the kind of support or the kind of treatment gears toward that need should be, should be equivalent to the kind of need. And I like this picture here, which basically tries to demonstrate the kind of, what fairness really, really means. And you realize that these people are, they have different heights, and obviously they have different needs. And if you look at it from the basis of each one of these wants to enjoy whatever is happening on the field, then something has to be done to at least help the person who is shortest to be able to, enjoy the same opportunity as the tallest person. All right. So to put this into context again, there is this very interesting aspect which has come to be globally known as the 1090 gap. And basically what this concept tries to allude is that, right from my first slide, I did mention the fact that Africa still enjoys the highest burden of disease. And therefore, when you look at it against the kind of resources being deployed to address the kind of challenges, the concept of 1090 gap basically says if you look at the burden of disease, the low and middle income countries have the highest burden of disease, at least 93%. But when you look at the kind of resources being deployed, so the research expenditure by purpose, you actually realize that only 10% or barely 10% of these resources are committed towards addressing problems that are more prevalent in low and middle income countries. All right, so that just to put into context the fact that even though we are in a world where we are all experiencing problems and we are trying to solve these problems, the disproportionate in terms of funding, that go towards addressing these problems can create a system that, makes people who are from a different setting be more disadvantaged compared to, others. Now, this slide here basically tries to is a slide from the World Bank, and what it does try to represent is the kind of partnerships that exist. And basically, this slide says there are more partnerships, towards between partners who are in the high income countries compared to partners who are in the low income countries. And like I already said, resources and power imbalances between the major resource and power imbalances between high income countries and low income countries. And this can create a scenario where there's unhealthy competitions, there are unhealthy collaborations, and there are unhealthy opportunities that can create perverse incentives to researchers and research and lead to questionable research practices. All right, so this is just my slide to basically take this closer home in terms of the kind of clinical trials that are happening globally vis-a-vis those that are happening in the global south. And you actually realize that despite the global south having the highest disease burden, the fraction or the proportion of clinical studies that are happening is barely 5%. And finally, in terms of the clinical trials targeting COVID-19, which is the more recent pandemic, you realize that clinical trials that were conducted against COVID were barely 3% compared to all the clinical trials against COVID that are happening globally. Now, what does that mean? It basically means within the context of low and middle income countries, and like I said, within the context of Africa, there is disproportionate, there's disproportionate, distribution of clinical trials that are, geared towards solving problems that are more prevalent in Africa or in the global south. Now, this is now where I begin to delve into the issue of, equity and why it is important for within the context of research integrity to think about equity and inclusivity. Well, from the previous slides, it is clear that certain structural systems can profile researchers or research stakeholders based on backgrounds, based on where they come from, based on race, and based on disciplines. If you come from the context where you are already missing opportunities, sometimes even the very little that you get you want to grab it with all your hands because it's the only opportunity that you have. And that can basically promote maintaining the status quo without really questioning the kind of practices that come with these kind of opportunities. There are some, cases of inappropriate credits that have been given for intellectual contributions, across researchers who are from the global south compared to researchers who are from the global north, or researchers from high income countries, and issues about inappropriate authorship practices where, for example, researchers have been involved as primary investigators in studies, but when it comes to the actual publications, they miss out in these publications. And therefore, against this backdrop, it just calls for the need for funders, journals, printers, and research institutions to begin to reflect on what is their moral obligation. And I can say that they have a moral obligations to deal with some of these barriers that perpetuate, the kind of unfairness that we can see within the research, research system. Right. And just to summarize, this aspect of fairness and equity, it is therefore important to think about power and resource differentials as an important determinant of what can, determine whose knowledge, whose skills, or whose agenda in the research and values are prioritized in the research enterprise. Fairness, therefore, allows all of us to think within the same, conversation table and allow synergy and working together on a level playing field. It promotes mutual decision making, which has been lacking within the, research enterprise, and it promotes, trust and mutual understanding. And I want to really emphasize these, guidelines that have been published by, stakeholders from the UK that underline some of the main principles that, people who come together to talk about partnership or to talk about collaboration can emphasize, including engaging with the context to understand what exactly exists, challenging the, status quo in terms of the assumptions about the evidence and the rest of the principles that have been. So this is one of the reference that I will be leaving, behind for you to read more if you want to read about this guideline. And therefore, when it now comes to inclusivity, we also need to think about, diversity. When we think about diversity, we are talking about respecting diversity of skills, knowledge as a key principle for fairness. It is important to understand that health issues face everyone, not just, people from the high income countries or people from the low income countries. And it is also important to understand that with now the concept of open science, a lot of the research output from low and middle income countries is actually consumed globally. And therefore it is important to bring everyone on board and be able to understand, to understand these issues from a, a diverse point of view. So research processes and practices mustn't systematically exclude disadvantaged people based on maybe disability, gender, or race. And I want to here highlight the recent report from the Wellcome Trust, which clearly stipulates that the Wellcome Trust still has some elements of racism. And it is interesting actually to see the first person who tweeted about this report was actually the director, the executive director of Wellcome Trust. And you can imagine how hard it is. But if you have to embrace diversity, you have to take very clear steps towards dealing with these problems. So overall, research culture and climate must promote diversity and engage openly on issues of diversity across all levels. We must together co-develop research goals, including with the people who will be participating in research, the communities who this research is intended to benefit. And this, of course, as much as it promotes diversity, it also avoids this concept of ethics dumping, which is something that is really part of the questionable research practices that Professor Lex talked about. In terms of inclusivity, I must say that there has been quite a lot that has happened around this area. Especially global partners have really underscored the importance of inclusivity. There are, for example, the Sustainable Development Goals, number 7, clearly stipulates the importance of global partnership. And of course, collaborations, there has been, calls where it's clearly stated that for this particular call, there must be, collaboration between, researchers from the global south and researchers from the global north. So we really cannot underestimate or overemphasize the importance of, partnership in global health. But what is important within the context of research integrity is to clearly understand that even though these, partnerships and inclusivity is important, some of the partnership have some extrinsic motivations that can undermine, trust. So, for example, there are lots of concerns about perceived exploitations within these, partnerships, unequal access to data, issues about ownership and data sharing. All these put together, they can undermine the mutual trust that is essential, in coexistence of researchers, and this can reduce the motivation and commitment, and can have perverse, effect on responsible conduct of research. Some of the questionable research practices that Professor Lex talked about can be attributed to the research environment and how it sustains some of the questionable research practices. And one example that I really want to draw on, based on what was published here, even as the conference continued, is what is called ethics dumping and helicopter research, where researchers from high-income countries, conceptualize research, come to conduct it in the global south, but then, after that, once they have collected the data, they leave, and nobody knows what happens with the data. Nobody is featured from those countries in terms of the authorship. And I want to allude the steps that journals like the Nature, for example, took towards addressing this. And it was a major debate during the, or conversation during the World Conference. And therefore, in summary, I want to say undertaking research that is not aligned to the needs of the society is one, it is unethical, and it is also a waste of public resources, because that research is highly unlikely to really address some of the problems that the society faces. A multidisciplinary team enables, which is a concept of diversity, enables analysis and understanding of research data from different lenses, and that can increase validity and reproducibility of research. Now, different individuals bring different types of relationships, knowledge, skills, perspectives to research processes, and of course that then underscores the importance of diversity. And lastly, a climate which is rich in diversity of skills, culture, and knowledge promotes openness, accountability, honesty, and critical thinking, which are very critical in research integrity, as you will have picked from now by all the previous presenters. And in conclusion, then I want to say we have to be deliberate, we have to be proactive, and we have to be intentional if we want to promote fairness, equity, diversity, and inclusivity. And as alluded to from my very initial slide, these issues can happen within the level of the individual researchers, but what the Cape Town statement on research integrity underscores is it brings out the fact that even though it is important to look at this from the perspective of individual researchers, the systems under which these researchers operate play a critical role. And therefore there must be fairness. And if I have to refer to the Research Fairness Initiative from the the Council on Health Research for Development, there must be fairness of opportunity. There must be fairness of processes, and there must be fairness of sharing of the benefits, the cost, and the outcomes. And there must be inherent recognition of the power imbalances and the kind of just limited resources that happen within different stakeholders. And obviously, when we come together, we can empower people who have limitations in different ways to work together to co-create and to coexist as stakeholders that are all geared towards promoting research integrity. I want to conclude by saying we must promote mentorship and capacity building, because this is something that has been alluded in the previous presentation, but also it is key in building capacity within the context of researchers from low and middle income countries. There must be mutual understanding, trust, transparency, and accountability. And of course, like all the other presenters have said, all these are important values and principles towards enhancing research integrity. I want to end there by saying thank you very much to Roxana and the entire team for inviting me to to this conversation. And I do hope that we will all have a very healthy conversation around how to promote diversity, fairness, and inclusivity in research integrity. This here is a very pertinent, they're very pertinent quotes by the World Alliance for Citizen Partnership, and basically they bring together this entire conversation, that if you want people to be involved, if you want to have different views, you must make sure you bring everyone on board. So leave no one behind. Thank you very much, and I take it back to the coordinator. Thank you.